better, but sometimes it's hard to tell.
I understand perfectly. Yes.
Well, it's so nice to meet you. I heard a lot about you.
Probably all bad. And if anybody said anything good, it's because I paid them.
I want to start with the thing that is just most unbelievable to me. Is it true that you're in the Michael Jordan documentary?
That is correct. Yes.
How? How did that happen?
I broadcast Jordan's first ever NBA game on TV.
Oh.
1980, yeah, October 1984. Yeah, they played against they were called the Bullets then, Washington Bullets, and the network contracted me to go in and do that game. It's the only video of the game is me calling the game, and I did it with Wes Unseld, who just died like a few weeks ago. Yeah.
Oh, what a legacy. Wow, that is awesome. I remember watching Michael play. I'm a lifetime Phoenix Suns fan, and I
Okay.
remember watching him play here in the late 80s. And
Sure, I've called a lot of Phoenix Suns games too, but
is that right?
Yeah, but I was never the Suns broadcaster. I would come in with the other team.
I'm still a season's ticket holder, but
Good.
There's no games.
So, yeah, yes.
I don't know what it means anymore. I hope I see another game, to be honest, in person. I don't know what's going to happen.
Yeah, I got you.
Well, I want to talk to you today about your hip. It's very gracious of you to agree to meet with us.
Oh, it's my pleasure.
We have a website called Hip Replacement Information, hipreplacement.info, whose goal is to give people who are thinking about having surgery a chance to learn everything they need to know about it. And I don't know about you, but the best information in the world, in my mind, always comes from someone who's gone through it. So the purpose of today is to sort of talk to you about your experience.
Okay.
And if you can sort of give it, if you were hearing this a month before you ever had surgery, what would you want to know? That's kind of the orientation of the thing.
Okay.
When was the first time you ever thought to yourself, I think I'm going to have hip replacement surgery?
I've been considering it for a number of years just because I've played every sport and I have just beat the hell out of my body by doing that. And I was a longtime tennis player in college and after college, played a lot of tournament tennis. And over the years, it's just taken a toll on me. And from that standpoint, I really felt that, wow, I can't play tennis anymore. I can't run anymore the way that I used to. And even though I'm an old dude now, I still am in really good shape for being an old dude. And I would still like to hit the tennis ball. I can still hit it really well. I just can't take a step to get to the shot. So I had to do something. And from that aspect, that's when I started investigating hip replacement surgery.
It's really strange, isn't it, that there's hip replacement surgery, which is the kind of definitive treatment, and there's not much, maybe a shot, maybe some PT. What kind of things did you do leading up to it, and did they do you any good?
Not really. I did a lot of stretching. I went to a chiropractor, had him do adjustments on my lower back because I've got apparently now getting some arthritis in my lower back. That never seemed to really help me that much. Help my back. My back feels great, but it never really seemed to help my hips. And then it got to the point where I was beginning to hunch over because I couldn't walk really well. And from that aspect, that was the determining factor right there. I just could not be me.
Yeah. What from that moment that people decide they want to have, I got to do something. Either get back to sport. I'm not a 90-year. I can't be walking around like a little hunchback guy. This isn't me. I need to do something. Most people encounter some obstacles to getting forward. What comes up in your mind? What obstacles did you encounter?
You mean before I had the hip surgery? Is that what you're requesting? Okay.
Yeah. After you decided, but before you actually got the surgery done.
Oh, okay. I was having trouble getting in and out of the car. I was having trouble getting upstairs. The worst one is that I couldn't put a sock on. And so now all of my shoes, if they weren't slip-ons, I would tie them and then force my bare foot into the shoes, like my golf shoes. I would play with no socks because I couldn't put the socks on. And so that was extremely frustrating. Tennis shoes, same deal. Every pair of shoes that I wore, I did it sockless, and even in the winter. So it just got to the point where I was extremely frustrated, was not in a good mood, and I'm kind of a good mood kind of person, to be honest with you. And it just, as I mentioned earlier, it just wasn't me, and I knew I had to do something.
Now, your surgery was a couple months ago. How long ago?
Right now, it's probably about 2.5 months, 3 months ago with Dr. Chow.
So 10 to 12 weeks ago with Dr. Chow. How did you find out about Dr. Chow, and what was it like meeting him? Tell me about that if you could.
I investigated as many hip replacement centers as I could. And then a friend of mine said, this is the guy you got to go to. He's the guy that pretty much came up with the new tool of having outpatient surgery. I did not want to go to a hospital. And from the only surgeries I've had in the past, I had my tonsils out when I was 21. That was uncomfortable. And then I blew my knee playing basketball. And so I had to have an ACL operation. Fortunately, I still had about a third to a half of it left. So they went in and cut out the spaghetti, and I rehabbed like crazy, and then just wore a knee brace the rest of my career. And I've been fine ever since that. But the hip situation was totally different. And when I came upon Dr. Chow and saw exactly what his system was, and you went in and you walked out in about an hour and a half, I'm telling you, Doc, for me, that was the selling factor right there. And he was correct. Did I walk out with the walker? Yes, I did. I was off the walker in about a day and a half. That's it.
That is wonderful to hear, and that's what we see. It's just astounding to me every time I hear someone say it. When I was a young boy, my mom had her hip replaced 2 weeks in the hospital. I mean,
Yeah.
And now walking in, walking out. I want to break down that day a little more. When you first walked in that surgery center, what was your impression? What was that like? What was going through your mind? Just take me there if you can.
I was scared shitless. I'm not a big doctor guy. I go once a year for a physical, and that's it. And fortunately, I'm in pretty good health. I don't take any drugs for anything other than Advil when my hips hurt. That's it. So from that aspect of it, I was pretty nervous. After I got done with the initial paperwork and you're sitting there, they took me back, prepped me. I probably went to the bathroom and I probably peed 10 times. They put way too much fluid in me. That's the only thing that I remember. They put me so much fluid, I had to pee every 10 minutes. At any rate, the doc came in, went over everything with me. We had a great conversation. And the next thing you know, I'm being rolled in, and I was asleep in a heartbeat. Like drugs, I could never be a druggie because they just attack my system. My metabolism, I think, is real fast. And so from that aspect, like if you go to a bar with me, 2 drinks is all I ever drink, because otherwise I'm just going to fall asleep right there after the 3rd one. So I just think I have that fast metabolism. I was out like a light. And when I woke up, which according to what Dr. Chow told me afterwards, took him about 30 to 40 minutes to do the operation. I was awake about 15 minutes or so after that. And after I, kind of collected my thoughts and everything, they came in with the walker, and I sat up and put my hands on the walker, and they said, we're not letting you go until you can walk around the office. And I slid off the bed and started walking around the office, and they said, okay, you're good to go.
Excellent. One of the reasons people recover so fast from the operation in the recovery room these days is the use of a spinal anesthetic. They actually give you the shot in the room and you're awake, but most people don't remember it. Do you remember any of that or
I
not at all?
remember the shot. Yes, yeah. When they rolled me in, he did give me the shot in the back, and I remember, and that's it. That's all I remember
That's
until
the
I
last
woke
you
up.
remember?
Yes, but I remember him saying, "Okay, I'm going to put this needle in you. You're going to feel it a little bit," and boom, I was gone.
Did it hurt?
No,
No.
no, no.
And the operation didn't hurt at all because
I was out. Yes, never felt a thing, and when I woke up, my hip was sore because of they had to, cut me open, but it wasn't sore because of the hip replacement. It was just sore where the incision took place. After I went home and sat around for about 2 days and then started to feel pretty good, that's when I dumped the walker. And then you still have the bandage on. And then after that, I went back for like 7 days, took the bandage off. I was already healed up. It's truly amazing. And it's only been a couple of months, the scar's almost gone.
That's fantastic to hear. Now, in that first week after surgery, it sounds like the pain was bearable. Everybody gets prescribed medications. Did you need them, not need them? What'd you do?
I only took them the first 2 days and that was it. And the only reason I did that was because they said, you should probably take these the first couple days. So I did. I had trouble sleeping the first night because I couldn't roll over onto that hip, obviously. The second night was a little better, and then it just got progressively better after that. But once they took the bandage off, and I didn't have that, I think maybe because the bandage is there for 7 days or whatever, I just think that in your mind it says, oh, you're hurt, so don't be doing that. When they took the bandage off, then I could roll onto my hip without any problem whatsoever, and I slept, just like I generally do.
One of the nice things about the SuperPath procedure that Dr. Chow is one of the founders of is that there's no restrictions as you completely recover. Some people say, well, can I do this? Can I do that? How did you find your way on what you could do and what you couldn't do in those first few weeks?
After I had the consultation with Dr. Chow following the surgery, he said, don't do anything for at least 3 weeks. Just get up and walk, go to the bathroom, sit back down. First week, I pretty much did that. Second week, I was feeling pretty good. By the second week, I was driving, and I have a 5-speed sports car, so I'm using, everything. And I didn't have a real issue driving at all. The third week, I went to the driving range and started hitting chip shots. And the fourth week, I went to the driving range and took out the big dog and started hitting some bombs. And so, as Phil Mickelson would say, I just hit bombs. So from that standpoint, that was my progression. Probably by the end of the fourth week, I played 18 holes and did not have an issue.
And in between, you would basically just listen to your body. You're an athlete, so you've been training your whole life. You knew how to respect your limits, and you just sailed and found out what you could do, and then you could do it.
That is correct. Yeah, I didn't do a lot until they took the bandage off because I just felt limited because that bandage was a reminder that something was done to me. After they took the bandage off, I felt really good. I was walking fine. You're stiff because my muscles have contracted so much due to the bad hip joint. And so for me, I still can't quite get a sock on my right foot. I can tie my shoes okay because it was the right hip that was done, but I just can't get down yet to quite get that sock over my toes. I get closer, but I have a feeling too, because my back also has arthritis in it as well, that'll probably remain an issue for me for a while.
Very interesting. It's amazing the number of people who have, if you have joint problems, you have joint problems. So often the knee, the knee right below, like you've had the ACL in the past, the back up above, these things just, a lot of people, the shoulder starts to make it tough, and God, they get you when you're down, don't they?
Listen, Doc, I can tell you, look, I'm old, but I'm far from dead. And so I just don't want to give up everything that I like. And it got to the point where I couldn't ski anymore. I couldn't play tennis anymore. To play golf, I looked like I was like 115 years old trying to bend over to tee up the golf ball on the tee box. So now I tee it up without a problem. I walk without a problem. I still have to have the left one done. So I'm going to have that take place. And I think once that happens, and Doc told me that these things are good for about 30 years. So by that time, okay, I won't care then. I've still got, but I still want to I want to ski again, and both snow and water. And I want to be able, I know I'm not going to be able to run like I did when I was a kid, but at least I want to be able to make moves toward the tennis ball. And I can kind of do that now, but the left hip is still problematic, although the left hip was not as bad as the right.
That's really exciting to hear. And I know it's going to be inspirational. It's just so hard for people to pull the trigger sometimes. It's amazing. I think, honestly, especially for us guys, how you just take a beating and a beating and a beating and a beating. Oh, I can't play golf. Oh, God, I can't play tennis either. Yeah, I didn't, I was skiing at my age. Is that really? And pretty soon you're a darn zombie walking around in your own life. You've made so many compromises, you can't do anything. And you got to just rip that Band-Aid off and get going.
And you're exactly right, because that's what I did. I just got to the point I can't take it. What was that? The old movie Network. I'm mad as hell, and I'm not going to take it anymore.
I'm not going to take. Remember him? Yeah, I forget that guy's name. That was great.
So that was it. That was exactly the way the light bulb went on for me. I just got to the point where the chiropractor was doing his job, and my back is improved, but the hips. And he showed me the X-rays, and he says, you got nothing. He says, it's just bone on bone. He says, I'm surprised you're even playing golf. Well, I would take 3 Advil and go out and play. And then for 2 days, I'd hurt like hell. And so, but I was willing to put up with that just so I could go out and play golf. And now I don't even take the Advil.
That is wonderful. Well, we are so grateful to you for the time today. I just can't thank you enough. Is it okay with you if I put this on our website so other people can hear your experience and write about what you've gone through?
That'll be fine, Doc. Absolutely. Yes, you have my permission. As long as you cut me a break when I get my left one done.
We will. You were already a VIP. Michael Jordan's first game ever. I mean, so in your mind, you've seen a lot of basketball players. Who's the GOAT? Who's the greatest of all time?
Well, now you're asking me a question that people are really going to get upset about, because in my mind, the all-time GOAT is Wilt Chamberlain.
For sure.
He was unstoppable. And back then, they didn't keep statistics on block shots, and he would average 8 to 10 block shots a game. You have to go talk to some really old timers to understand how great Chamberlain was. But because he only won 2 titles, he doesn't get the same respect. Plus the fact, in today's world, people think, well, he just played against 6'5" white guys, and that's all. That's why he was. That's the furthest thing from the truth. You're playing against Bill Russell. You're playing against Walt Bellamy. You're playing against Zelmo Beatty, Nate Thurman. In his later years, he played against Kareem Abdul-Jabbar when they won the title in Milwaukee. Chamberlain outplayed them and knocked them out of the playoffs when the Lakers won 33 straight games, which is an NBA record, and then also won the title that season. Look, I get the deal with Jordan and the love affair. He came along at just the right time. To me, LeBron is the most dominant player that we have today. And so I would have all three of those guys 1, 1, and 1. That's the way that I would look at those three guys, because LeBron's game is different than Jordan's. Jordan's game is different than LeBron, and Chamberlain was unstoppable. And people just say, well, all he did was dunk. Go back and look at the highlights. Look at his fall away jump shot. Look at the way that he could pass. He's the only center to ever lead the league in assists. Led the league in assists. And he dominated rebounding. He averaged 20 throughout his career. He averaged 23 rebounds per game. Nobody is ever going to eclipse that. So you have to go back and really do some research. But in today's world, oh no, it's Mike. It's Mike. And then after they run the last dance, oh, it's Mike. You have to understand the game and understand the time frame that took place within those players' lives and how dominant they were. And the funny part is, too, is that when people say, well, they would never dominate today. Are you kidding me? Great is great. And you're going to dominate in any era if you were the best player in that era. So my guys would be Chamberlain, Mike, and LeBron. All of them are the number ones as far as I'm concerned.
Well, I really, I wasn't expecting that. I really appreciate it, and I see your point. I see your point. That's very well thought through. And then, you know, everybody's, when I grew up as a little boy, it was Kareem.
Sure.
It's hard to overcome and later on Michael, but yeah, it's hard to overcome your heroes. Even Connie Hawkins, you know.
I love Connie Hawkins, and I played tennis against Connie Hawkins, who was a very good tennis player.
We're going to get that other hip fixed, and you're going to be out there too.
Thank you, pal.
All right. Thanks again. You have a great day.
Dan, it's great to talk to you. Thank you so much.
If you need anything, let me know.
Okay. Thank you, pal.
You
okay,
got it.
bye.